I find it really intriguing that 70% of the NHS spend and time and resource goes into the management of people with long-term conditions, but mostly we spend it in the complications of disease. And what is exciting, I think, about today is that we can get ahead of that. We can give people the tools to self-manage, which is what people are telling us they really want to do. We can use digital where appropriate. We can use behavioural science insights to really make a big difference across the country. And I think see a shift in spending, instead of on the complications, actually helping people lead many more happy years, self-managing their disease confidently. And that is incredibly exciting to me. I've really enjoyed today. I think what's been good about it is we've heard really practical examples of how getting the best data on population health can really make a difference to people's lives. And I've loved the stories that we've heard from across the country of how this is beginning to happen in practice and move beyond the theory that we've heard before into actually making a real difference to citizens.